Hello and welcome everyone. Thank you for joining today's presentation from the Health Connector, where we will present an overview of the Health Connector and resources available for those in need of health insurance coverage. Today's presentation is Need Health Insurance? New savings are here through the Health Connector. We have a number of participants who have signed up, but we will get started at 1 p.m. today as scheduled. Hello and welcome everyone. I'm Shaitra Sanders from the Massachusetts Health Connector. I will be facilitating today's session. I'm joined by my colleagues Nikki Conte and Melissa Montron, who will be presenting today's information. And we are here to help answer any questions you might have. I would like to take a moment to thank elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been disabled. The presentation portion will last approximately 30 minutes. Then we'll have time for a question and answer period at the end. If you would like to ask a question at any time, please use the Q&A functionality button. We will be monitoring your questions throughout. Please do not disclose any personal information or protected health information when you ask your question, as others on the call are able to see what you've written. If you have a specific personal scenario that you want to discuss with someone, we will be providing contact information for the Health Connector's Customer Service Center and instructions on how to find help from a local navigator. We are recording today's webinar. Following today's meeting, you'll receive an email with the presentation, along with a brief survey about the information we've shared, so there's no need to take detailed notes. Please complete the survey if possible, as we'd appreciate your feedback on today's session, and your input will help us develop future presentations. So without further ado, let's go ahead and get started. Nikki?
Thanks so much, Shaitra. And hi, everyone. Thank you very much for joining today's presentation. So if you go on to the next slide, I just want to provide a little bit of an overview of our agenda. For today's topics, we'll share information about the Health Connector and specifically about the American Rescue Plan, just to ensure that you're familiar with our organization, as well as the new savings that are available because of the American Rescue Plan. Then we'll get into some specifics about getting coverage through the Health Connector. You'll hear from me, Nikki Conti, as well as my colleague, Melissa Montrand, where we'll be giving you some real tips for applying and getting coverage. We'll talk about getting help, just go over reminders, and again, any additional resources you might need as you're going through this process to get health insurance coverage. So going on to the next slide, just want to start off with an overview of what the Health Connector is. Some of you may or may not be familiar with our organization, so it's always important for us to ground you and just let you know that we are the state's health insurance marketplace. So we exist to offer individuals, families, small employers access to affordable health insurance coverage. So you might be wondering, who are the people that get coverage through the Health Connector? And basically, it's those who don't have access to health insurance coverage from some other source. So for example, people who don't have coverage through a job, a spouse, their partner, etc. So these are the folks who can and should be applying for health insurance coverage. A lot of people who do apply qualify for help paying for their plans, especially now with new savings through the American Rescue Plan. You will see, or you can see, some additional more savings than you had in the past. And then also important to note here on this slide is that people can also buy dental coverage through the Health Connector. So when you're thinking about your health overall, we just want to be sure that in addition to your health insurance coverage, you are also considering what kind of coverage you want or might need for dental. So going on to the next slide, I just want to orient people to, orient all of you to some of basically to the structure of the plans, some terminology, etc. And also give you some assurance that when you are coming to the Health Connector to get health coverage, you can rest assured all the plans sold through us meet both state and federal coverage standards. So in Massachusetts, we still have an individual mandate, which means that adults are required to have coverage. However, you never have to worry that if you get coverage through the Health Connector, you would never have to worry about paying any type of penalty. So I'm going to quickly orient you to each of these categories. And then when we get into the presentation, when Melissa and I get into the presentation, we'll be giving you more information about all of these. So qualified health and dental plans. I've already mentioned that all of the plans sold on our site or through the Health Connector meet state and federal standards. But what I'd like you to know from the qualified health and dental plans is that as a Massachusetts resident, you can choose from a variety of plans that are available in your area from leading carriers in Massachusetts. Now, only through the Health Connector can you get health plans with advanced premium tax credits. Now, these are federal tax credits that are available to people within certain income ranges that basically allow you to reduce the cost. So it allows for your monthly premium cost to be reduced. And I will spend some time in later slides explaining how that really, how that practically works. Now, available only through the Health Connector and in Massachusetts are what we're calling connector care plans. So these are a set of health insurance plans for people in lower income ranges who meet our eligibility requirements. And they either have the option, again, depending on their situation, their household size, income, etc., they have the option for low or no cost health insurance coverage. So very good comprehensive health plans, but at lower costs. Also important to note, we do offer catastrophic plans, and these are available to people who are 30 years of age or under with a hardship exemption. Same thing to keep in mind about catastrophic plans if you're wondering about them. Sometimes it could look really attractive because the premium costs are low. However, the cost of point of service, the cost when you're getting care, could be higher. Depending on someone's situation, this might be the right type of plan for you. But again, just want to explain why you're seeing the cost structure the way it is. And then lastly, dental plans. I mentioned that we do offer dental coverage if you want to purchase dental coverage, and that is available for individuals, children, families, and small employers, which include pediatric only plans as well as plans with low and high deductibles. So going on to the next slide, I want to introduce you to the American Rescue Plan. Now, this law was just signed in March of this year. And one of the aspects of the American Rescue Plan helps to make coverage even more affordable to many more people. So most people who are applying through the Health Connector, enrolled in Health Connector coverage, are already getting help paying for insurance. But now people can save even more because of the American Rescue Plan. And a lot of people who didn't qualify for any help before can now see lower monthly premiums as well. So as you can imagine, we're pretty excited about being able to offer this and explain this to folks. So going on to the next slide, I want to just here on slide 7 talk maybe in a little bit more depth about how you can experience these savings. So I've already mentioned that there's more help paying for the monthly premium costs. And again, the first bullet here, people whose income may have been too high in the past to qualify may now be eligible for some of these savings. And the way that is happening is because instead of an income limit for financial help is going to be based on affordability. So I previously mentioned tax credits. Tax credits are going to be granted that lower the monthly cost of plans. So they're available for people at any income level if the plans cost more than 8.5% of their income. Really important to note is people who qualify for these savings can only get those savings if they enroll in coverage through the Health Connector. And we're really pleased to say that we have a new tool that lets you preview the costs of plans that you might qualify for. And then later on in the presentation, my colleague Melissa is actually going to show you that demo. So before completing an application, if you just want to get an estimate of what plans might cost you, you can use this tool. A couple of other important things to note is that there is more help available to people who have been on unemployment income at any point in 2021 when they get their coverage through the Health Connector. So for some people, basically that means that they're going to be eligible for a connector care plan. So if somebody collected unemployment income in 2021, they can get into a connector care plan, and they can choose a $0 plan if they'd like, and that is available through the end of this calendar year. So we'll certainly talk more about that, but really for this webinar today, we wanted to especially focus on those people who may be either currently collecting unemployment income or did collect at some point during this year. Now, with the last bullet here where it says coming soon, we're talking about people who got unemployment income at any point this year. We're making some changes to our system to allow you to come back in and click on a checkbox that lets us know that you collected unemployment income during this year. And then you're going to be eligible for those $0 or lower cost connector care plans. So we're really excited about that. Going on to the next slide, I also want to mention some new help that's available paying for COBRA. Now, this is outside of the Health Connector, but it's important to note that the American Rescue Plan included help with COBRA payments that basically make COBRA, the cost of COBRA, $0 a month for people. But those savings are only available from April through September of this year. So depending on, I'm not sure, there's plenty of people listening right now, but again, we don't know what everyone's circumstances are. So for some people, it might be best to keep or enroll in COBRA. For others, it might be better to enroll in the Health Connector right away. But it's also important for me to let you all know that when help paying for COBRA ends in September, people who chose to take COBRA aren't going to be blocked. We're going to be able to give them an option to enroll through the Health Connector. So losing help paying for that COBRA benefit will be a qualifying life event that lets somebody enroll outside of an open enrollment period. So going on to the next slide, I'll just point out a couple of little sample savings here. I don't want to say little because some of these are much bigger, but I just want to point out a couple of these images here. Let's say you have a 50-year-old in Worcester whose income is $44,660, and their eligibility was for Health Connector plans with advanced premium tax credits only. So before the American Rescue Plan, their premium was $371.58. Now with the American Rescue Plan, their new premium is $269.82. So that's a monthly savings of $100. And we all know that's real. That's $100 a month. That's real money. So we're very pleased to be able to share this with all of you. Now, I won't go into the other sample savings here because Melissa will go through and show you how to use the Get an Estimate tool. But we, again, just know that the savings that are available to people, they're going to vary based on their age and where they live in Massachusetts. So in case you're wondering, like, okay, why is it that this person is in Worcester saving $100, but the person, the 25-year-old in Great Barrington, when I look there, they're only saving, $16.75 a month. So again, it's going to vary by age and also by where the person lives. So going on to the next slide, This is where I'm going to hand the presentation over to my colleague Melissa, and she's going to give you a bit more detail about who can apply and getting that process started.
Thank you so much, Nikki. Hello, everyone. So who can apply for the Massachusetts Health Connector? So you will be determined eligible to apply if you live in Massachusetts, are a U.S. citizen, U.S. national, or are otherwise lawfully present in the U.S., and you don't have health insurance. You would not qualify if you are enrolled in Medicare, Mass Health, or Medicaid, or other public health coverage, or if you're offered affordable, comprehensive health insurance from an employer, or you are in jail. So who can enroll in the Massachusetts Health Connector? So the great news is that we have extended our open enrollment, and it's currently extended through July 23rd. So for all Health Connector plans, your health or dental coverage can start as early as the first day of the month after you enroll. If you need coverage sooner, apply right away. You may find you qualify for Mass Health. So applying for coverage. So basically, there are 3 ways to apply. The first one is you can go online at mahealthconnector.org. And we also have a Spanish version, which is the mahealthconnector.org/ES. You can apply by phone, or you can apply with the help of a partner community organization or health center. There's one application to find out if you qualify for coverage through the Health Connector, including help paying for coverage or for coverage through Mass Health. You will get letters from Health Connector and Mass Health that will tell you your next steps. What do you need to apply? So you will need Social Security numbers for everyone applying if they have one, immigration documents for all non-US citizens who are applying if they have one, and then you can learn about which documents are okay to send in if you click on the link. So also recent pay information if you have it, such as copies of your last 2 pay stubs, your unemployment amount, monetary determination if you are collecting unemployment, and information about your current income. If you don't have all of the information above, give us what you have and we'll send a letter asking for more information if we need it. So application for individuals and families. So again, you can apply online at mahealthconnector.org. And also, as I had mentioned previously, we do have a Spanish version, which is the mahealthconnector.org/ES. So basically here, this is showing you the website, our page, where you can go in and apply. And we circled in the way you can sign in. And if you don't have an account with us, you can create an account with us. And basically, this is what the page would look like once you sign in. How do you enter income if you're unemployed? So when you complete an application, you'll be asked about your current income and your estimated income for the year. So what you want to do is you enter your current income as it is now, including unemployment income. Then you enter your expected yearly income based on what you think you'll make over the course of the year. When entering your yearly income, please also consider how much you earned so far this year. Add any unemployment, including any extra dollars per week you may be receiving. If you think you will be returning to work later this year, include what you might have earned. And if your income changes later, just make sure to update your income as soon as possible. And now I will be sending this back to Nikki to continue on with the webinar.
Thanks so much, Melissa. And Shaitra, if you want to just go on to the next, actually, before you go on to the next slide. So Melissa talked a bit about keeping your income and application up to date. I think what I want to do here is just explain a little bit more about why it's so important. So she mentioned how important this is, but it's really important because when the information that you enter into the application, the income information, that once we have that information, that's how we determine how much help you can get towards your health insurance coverage. So those advanced premium tax credits that we've been talking about, when you are determined eligible for advanced premium tax credits, at the end of the year, you need to reconcile those tax credits when you do your taxes. So you have the opportunity within the application to say, you know what, I might be eligible for $200 or $300, but I know my situation is kind of fluctuating up and down. You have an opportunity to adjust that amount. You can take less during the year. And then at tax time, all of this gets reconciled. Basically, all of this comes out in the wash. So we really want you to keep your application as up to date as possible so that you're getting the right amount of help. So if you go on to the next slide, in this next section, we're going to talk a little bit more about getting help paying. So if you go on to the following slide, again, we're talking about the two kinds of help paying, the two kinds of help that are available to you. So we have those advanced premium tax credits that lower the premium amount you pay each month. The IRS sends your tax credit directly to the insurance company. So you'll pay less each month. So you don't see those dollars right away. You just see the savings. And you can apply some of that amount or all of your tax credit to your monthly premium, as I was mentioning. Now, at the very beginning, I mentioned the Connector Care program. Again, Connector Care program, unique to Massachusetts, unique to the Health Connector. The way in which we can keep the cost of those premiums so low for consumers is because it's a combination of federal advanced premium tax credits as well as state dollars, and those together reduce the premium amount that consumers pay each month. Now, Connector Care plans they have low monthly premiums, they have low out-of-pocket costs, and there are no deductibles for people when they enroll in the Connector Care plans. So if you are someone who's listening in right now and you are currently collecting unemployment income, really, this is one of the reasons why we very much appreciate, we very much want to encourage you to take a look at enrolling into a Connector Care plan if you currently do not have access to health insurance. Now, for Connector Care, depending on the plan type you qualify for, you could choose a plan for as low as $0 or up to $133 per month. We do have a sample of these costs at the end of the presentation, or we can show you on our website where you can see the benefits and copays chart for Connector Care. Going on to the next slide. I just want to talk a little bit about the income guidelines to get help paying for coverage. So here I mentioned, we talked about Connector Care, and we've talked about, it's really dependent upon someone's income and household size. So for example, a family of 4, if you're making less than $78,600 a month, you may qualify. And if you meet all of our other eligibility requirements, you may qualify for Connector Care. Now, before the American Rescue Plan, we had income limits for people to qualify for advanced premium tax credits. So you can see what those were. Now the American Rescue Plan removes that income limit, and instead of that an income limit, people are going to qualify for advanced premium tax credits based on affordability. So it's going to be available to lower the cost of monthly premiums so that you do not have to pay more than 8.5% of your income. So going on to the next slide. I just want to take a pause here for a moment and just acknowledge that we are covering a lot of detail. We've covered a lot of detail about the eligibility aspects, the financial savings that could be available to you. But if you are newly applying for coverage, again, we don't know what your circumstances. So this may be the first time that you need to choose a plan and enroll. Maybe you worked at a company where, there was only one option or just a couple of options. So want to give you some guidance on some of the tools that we have available and how you can go through that process when you're shopping through the Health Connector. So going on to the next slide, okay, once you know what you qualify for, your next step is going to be to shop for coverage. So we have a variety of tools where you can enter some of your preferences. So you can enter information about any providers, doctors, or let's say you have prescription medication preferences. You can put that information in and then compare the plans that are available in your area, as well as compare those costs that are associated with them. Now, before you complete the application, you can use our plan comparison tool. And as Melissa and both Shaitra have said, you will get this presentation. So you can click on these hyperlinks and you can go to the tool and you can enter some information and see what's available to you. You can also find pricing. We have a preview plans button, but also Melissa is going to show you how to get an estimate to find some pricing and which plans are available in your area. So going on to the next slide, when you're in the online application, you're going to have an opportunity to also enter your preferred providers, facilities, prescription drugs, etc. So on slide 25, what you're seeing here is basically a sample of the page from within the application. You can see that it's circled here. Yes, I want help finding a plan. And there's a checkbox next to my preferred providers and facilities. So going on to the next slide. This page shows all of the plans that are available in your area based on some of the preferences that you've entered. So as an example, here, the person selected a couple of doctors as well as a health center that they wanted to be sure would or could be included in the plans. So in the far right here, if you're following the circled areas, you can see that this person has about 48 options to choose from. And on our page, we limit it to, the first 10 and then you can click through. So there are different ways you can sort and different ways you can filter, just like any shopping website, so that you can, minimize the options that you are comparing. So going on to the next slide, I want to point out here that when you're in the application, if you are required to make a payment for your monthly premium, you have that opportunity to do so online. Now, our deadlines for making payments, enrolling and making payments is always the 23rd of the month. So I just want to point that out. And you'll also see here that you have a button for making a payment. So going on to the next slide, this is where I'm going to hand it back to my colleague, Melissa, and she'll talk a little bit more in depth about the two different ways, or actually a few different ways that you can get help with this process. So Melissa, all you.
Thank you so much, Nikki. Okay, so there are a few ways that you can get help enrolling in health insurance coverage. So free enrollment assistance is available through the Health Connector customer service and across Massachusetts through community partner organizations. So please keep in mind our customer service number is 877-MA-ENROLL, and that number is 877-623-6765. And our TTY number is 877-623-7773 for people who are deaf, hard of hearing, or speech disabled. For information about hours, days of operation, and more, please also go to the Health Connector Customer Service Center. And for the community partners, so we do have trained and certified navigators and certified application counselors who speak many languages and can help you from application through enrollment into health insurance plans. They can also answer questions about eligibility, the application, payments, plan details, and healthcare reform rules and requirements. It is recommended that you call ahead to schedule an appointment for help. And to find help in your language, you can also go to Get Free Help Near You. So now I'm going to pass this back to Nikki.
Thanks, Melissa. And Shaitra, if you want to go on to the next slide, perfect. We just wanted to leave you with a couple of reminders and details about shopping and enrollment. So again, not knowing who's out there listening, we wanted to just acknowledge that if you've lost employer coverage, know that that is considered a qualifying life event, and that gives you a special enrollment period for getting coverage through the Health Connector. Be sure to apply, compare your options through the Health Connector within 60 days of losing your employer-sponsored insurance. So that's really important. As Melissa talked about, you can apply for coverage online. Remember, we have an English application as well as a Spanish application, or you can apply over the phone or with the help of an assister. Melissa mentioned the different community partners. So again, staff at hospitals, health centers, other types of community organizations. Go to our website and you can search by your zip code and see if there's someone near you. And if you go on to the following slide, all right, here the first bullet is really just an acknowledgement that if you apply online and find that you can't shop for a plan and you do need health insurance coverage, you don't have access to health insurance coverage, call the Health Connector's customer service and just explain and have them step through the application with you and just see if there are any reasons that they're aware of that you would be blocked, and they can help you get over the finish line. The next bullet here, also very, very, very important for us to keep reminding all of you. We are currently in an extended open enrollment period, as Melissa talked about, and the deadline, our open enrollment period is ending this month. It's ending July 23rd. So really, if you need coverage or you know someone that needs health insurance coverage, please, doesn't matter what reason it was that they didn't apply and enroll in coverage, have them do that. If they need to pay a premium, you need to pay a premium, do so by the 23rd of the month. And you can get coverage that starts as soon as August 1st. Technically, it's important for us to just state that you can also choose to have your coverage start the second month afterwards. That is an option, but if somebody's looking for coverage now, if they're looking for coverage August 1, they need to take action. And again, the deadline is July 23rd. Again, Melissa mentioned free help, customer service is free, working with a navigator is free, working with the CAC, and all of this is available to you. And, you know, as Melissa mentioned, to call ahead and make an appointment, it's especially important right now as things are starting to open back up. There's still a lot of flexibility for getting support. So if your preference is to get support over the telephone, or you're comfortable, you want to do a Zoom webinar with someone like you're doing now, you can contact these organizations and set up an appointment. And a lot of them are offering some in-person as well. They're still in a hybrid mode. So some in-person as well as virtual, whatever is going to meet your need. We want to help you get across the finish line. Before we go to questions, though, I do want to pass this back to Melissa, and she is going to give us a demo. So I will take myself off screen, and Melissa, it is all yours to share.
Thank you so much, Nikki. Okay, so I'm just going to share my screen if you can give me 1 second. And hopefully everyone can see my screen now. So basically, when you come to the Health Connector page, the healthconnector.org, you can go here on Get an Estimate, and you want to click on Individuals and Families. And when you do that, you have to answer a few questions regarding your household. So you want to pick your coverage year. You want to enter your Massachusetts zip code, and I'm going to actually do a Brockton zip code. And then what you think your household income will be for the year. So I'm just going to say maybe 55,000. And this is a number of people in your household, including people who may not need coverage. So I'm just going to say a household of 2. Let's just say it's a married couple. And then here, age of household. So I will say 34 and maybe 36. Also keep in mind on the side here, we have a few questions that are very important to answer. So this person needs coverage. I clicked on this, yes. This person is pregnant, or this person is disabled or blind. Whatever situation pertains to your household, you just want to make sure to click on that. And then you go to your results. And then you're just going to have a reminder here that this is actually not an application for health coverage. This is just basically an estimate. So continue. Okay, and now we're here at the estimated eligibility. So based on the information that we provided, this household of 2 qualifies for an advanced premium tax credit to help lower their monthly health insurance. So the maximum tax credit amount would be $390. So they're eligible for silver plans with monthly premiums as low as $276.84. So basically that is the savings for this household of 2. So the potential eligibility for the first person who's 34 years old would be the Health Connector plan with advanced premium tax credit. And then it would be the same for person number 2. So let's take a look at preview plans. So exactly what would you be eligible as far as the plans go? So again, we have the estimated savings details on the top. And then now we're taking a look at the qualified health plan options. So here we have the names of carriers that would be available in your area. We have the plan names right beside that. We have the coverage level. We have the actual monthly premium costs. Then we have the APT savings. And then what you would actually pay per month. So your actual saving costs per month. And then based on your, what you thought would be the best, could be based on provider networks, or, what you felt comfortable in choosing, that would be what would be available to you. So I'm going to stop sharing the screen now, and I'm going to take it back to Nikki.
Thanks, Melissa. Thank you for sharing all of those plan options. So as you saw, Melissa, there were, as you saw with Melissa, there were well over 10 options for that person in the Brockton area. So hopefully that demo of the Get an Estimate tool helps you kind of get a sense of what you can do before you even apply for coverage. You can go in and just see what kind of savings you might get. So with that, Shaitra, both Melissa and I are ready for questions.
Great. And I apologize, there might be a little bit of noise in the background. My apologies. There seems to be a little bit of construction in my building unit. So my apologies beforehand. But yeah, we do have a few questions. And if anyone else does have questions during this, Q&A period. Feel free to put it in the Q&A box, and we'll try to get to it before 2 p.m. So we have about 20 minutes right now, Nikki and Melissa. And let me start off with a question that we did receive. What if I'm currently collecting unemployment income? What do I need to do, and what should I expect when I apply? Also, once the application goes through, when will they see their benefits?
So if the person is currently collecting unemployment income and they want to take advantage of that they want to take advantage and enroll in that connector care benefit, that $0 connector care plan, what you need to do basically is apply either online or with the help of someone on mahealthconnector.org. Go through your application process. Be sure to enter all the information about your, we're going to be asked about current income as well as your income for the whole year. You want to be sure to include the unemployment income as part of your application. And you also will be indicating that you're collecting, you're getting income from unemployment. So on the back end, what will happen is the system is going to acknowledge that you're getting unemployment income. When you get to the final screen of the application, you're going to see a message that says, I'm going to improvise here. I think it says something about like checking back within 24 hours. So the online application itself is immediate. You're going to go through the process, click to get your results. You'll see an eligibility determination. But for those of you that are currently getting unemployment income, you need to wait 24 hours. And then when you come back to the application, you're going to see your connector care, the connector care option. So you will see the $0 connector care plans if you want to take advantage of that and enroll in those, or if that's not the one you want and there are other plans available in your area for, a little bit higher price, you can enroll in that. So I think hopefully that makes sense. And maybe I'll also just ask my colleague Melissa if there's anything you would want to add just from a practical perspective. I know you help a lot of people with this process.
Sure. Thank you, Nikki. Yeah, what I always try to remind people at every stage of the process is if anything changes with your application, you can always go back online and make those changes, especially with income. Sometimes, things happen and, for whatever reason. So if you need to go back, you can go back and make those changes.
Great. Shaitra, did we get to all parts of your question?
Sounds like it. If not, we'll get the question again in a different form.
Okay, great. Thank you.
Well, the next one also has to do with unemployment. I do believe I may have heard this mentioned during the presentation, but it's always good to reiterate things that are said during the presentation. What if someone is not currently receiving unemployment, but did earlier this year? What should they expect and when will they see benefits through the Health Connector?
Okay, great. So as we mentioned, these benefits through the American Rescue Plan are really new. So we've made changes to our system to basically allow or accommodate that, people to get access to these benefits as soon as possible. So towards the end of this month, we are making an additional change to our system to allow for a checkbox so that if you collected unemployment at some other earlier this year and you're still in a position where you need health insurance coverage, you can come back to the Health Connector, either complete an application or update your application and click on the checkbox to say that you had collected unemployment income at some point in 2021. Then that's going to basically, kick off some back-end processing. You're going to see that message, like, please wait 24 hours. And then you will see your connector care options. So again, without knowing kind of where people are themselves or in the process, if you're wondering, should I do that? Like, should I apply right now then, or should I wait till end of month? I think it's always important to say, if you need coverage, apply now. Simply apply. And then, as Melissa said, please just come back and update the application. Or if you are that person who, collected unemployment income earlier in the year, just simply, you can call customer service or go online yourself, or even get help from an assister, and they can help just check that box for you that you were collecting unemployment earlier this year. So I hope that helps. I hope that answers the question, Chaitra.
Sounds good to me. So we have a question about someone who actually has possibly a coverage offered through their job. So what if a person is offered coverage through their job, but they might not think it's affordable? Can they get coverage through the Health Connector with subsidies?
So thank you. This is a question that we hear quite a bit. And earlier in the presentation, Melissa went through a list basically of those who could qualify, those who should apply. And essentially Health Connector coverage is for people that don't have access to other affordable comprehensive coverage. But you might be saying, well, I do have it, but as Chaitra said, like, I don't think it's affordable. You do, there is opportunity. You should apply then. You can apply. But what we need from you is you need to get the detailed information from your employer about the plan, the cost of that plan, because you're going to enter all that information into our application. And then our application is going to use the state's affordability standards and essentially figure out, okay, does this health insurance plan meet affordability standards as set out by the Commonwealth, and then kind of figure out whether or not you can in fact get coverage through the Health Connector instead. So, I mean, the word affordability, it's kind of nuanced, right? What might be affordable to one person might not be affordable to somebody else. So we do have a set of state standards to help us determine that.
Thank you for clearing that up, Nikki. Now, I did hear, I believe it might have been Melissa or yourself talking about, updating the application throughout the time that you have it. So is this part of if their income should change during the year, what should they do? Is that part of updating the application?
Exactly. Actually, I'm going to hand this to Melissa, because maybe Melissa, you can explain, like, when they are updating their application, would you be able to just describe, like, if they come back into the application, can you just describe where they would go to make those updates?
Sure, definitely. So I'm going to try to be as detailed as I can. I'm a visual person. Basically what you need to do when you go back and you sign back into your application, there is a section that says edit. So when you edit the application, it will bring you to a series of questions that basically is asking, well, what exactly in the application do you need to edit? And there will be one selection that says that you want to report changes to your income. So you would click that box, and basically it puts you right back into the application, but it will bring you ahead towards the income section. So when you do go into your income section, so you basically, it will say your employer name, and then right there in that part, you would want to include your income or whatever changes that you are reporting at the time. So then when you report those changes, it will take you to the next screen. And in the next screen, it basically says, well, do you think your income is steady from month to month? So this is where we want to pinpoint exactly how much you make and get the best. If your income is not steady, just try to get the most accurate amount in that section. And then it will also ask your projected yearly income. And this is another opportunity to put in the most accurate number. So there are different questions and different ways to get the most accurate results in reporting what exactly your income changes are. And that does also include for any unemployment that you may be receiving. So hopefully you get that part there, and then it brings you to the entire application to complete. And then based on that information, you also get a what your eligibility would be based on the information that you've just reported. So hopefully I answered that question as detailed as I can. But yeah, Nikki, is there anything else you wanted to add? Did I miss anything?
Oh, I don't think so. I think the
Okay.
only thing I wanted to add for the participants is to keep in mind that we are recording today's session, and then in the next couple of days, this recording is going to be available on our website. So if you want to come back later on and just go to the Q&A section and say, okay, how do I find, where do I enter or change my income? You could listen to that section again.
Great. And I think we have a little bit under 10 minutes, so I'm going to try and get through the rest of these questions pretty quickly, ladies. If someone currently has coverage until August 31st from their former employer, and they are actually receiving unemployment benefits now, when should they apply for the coverage through the Health Connector? Do they wait until their coverage ends with their employer now? Or can they apply now for coverage to begin on September 1st?
So this is a really great question. You do not need to wait until your coverage ends. You can apply within 60 days of losing your health insurance from your former employer. So when you could go in now, complete the application. You're going to need to indicate the date the coverage is ending. And then you could choose your coverage to start September 1, or, I don't think you'd want it to start later, but if you wanted to, sure, you could choose October 1, but you can apply now.
Great. Now, we were talking about the American Rescue Plan very early on. How long will the new American Rescue Plan unemployment benefits be available? And also in relation to that, is the Connected Care program based on the American Rescue Plan, or is the Connected Care program always available?
Okay, got it. Great questions. Okay, so the Connected Care program has been in place since the Affordable Care Act has been in place. So prior to the Affordable Care Act, we had Commonwealth Care through the Health Connector. And then we currently have these Connected Care plans that will be available. And are available. Now, the American Rescue Plan benefits are extending or making these savings available. My understanding is at least for the next 2 years, these additional savings. Now, specifically for those people who are on unemployment income or collected unemployment income this year, those extra savings are only available for calendar year 2021. So that's why we are very much trying to promote these savings, because this Connected Care benefit to those people collecting unemployment income or who have got unemployment income at any point in 2021, this is really time limited. So we really want people who have been in this situation, who need coverage, to be able to take advantage of it. Did I hit all the categories, Shaitra?
I do believe so.
Okay. And folks, let us know if you have any additional questions based off of that.
I'm not seeing anything come in. So do you know when the mass health pandemic protections will be ending so that people can get back onto their connector care plans?
So that is a really good question. So at this point in time, we do not have an official date that we're able to share with folks. So some of you might have applied for Health Connector coverage and then found that based on your particular circumstance, you were determined eligible for Mass Health. And the Mass Health benefits are very comprehensive. And essentially, people who have access, who got determined eligible for Mass Health, have that coverage until the pandemic, that emergency period is officially over. So don't have anything official to share at this moment, but just acknowledge that it is still, people are still internally, we kind of call it protected in Mass Health coverage. So if you or someone is enrolled in Mass Health coverage, that is still the case. You will not lose access to Mass Health.
Great. Now the answer to this may be what Melissa showed us in the end, but can you confirm, is there a way to compare plans without completing an entire application?
You got it, Shaitra. Melissa showed the example. You just want to go to mahealthconnector.org, and from our website, from our homepage, there's a button right in the front and center that says Get an Estimate. Or as Melissa showed you, you can navigate to the blue bar at the top, click on Get an Estimate, choose Individuals and Families. You do not need to complete an entire application to find out what the savings could be associated with your household size, your zip code. You enter some of that basic information and you will get just what it's called. You'll get an estimate. You'll be able to preview what's available to you. Now, there is a caveat. For those people who are collecting unemployment income or did collect unemployment income, we don't have a way through that Get an Estimate tool to show you the connector care connector care options that are available to you. So for those of you who are currently getting unemployment or got it at some point this year, know that there are even more savings available to you through the connector care program.
All right, so we got just a time for one more question. Is it
Okay,
an American Rescue Plan question, and it's also something that you made sure to point out in the beginning about dental. Does the American Rescue Plan provide help paying for dental coverage through the Health Connector?
Okay, really, really good question. And I think I'm going to have to, what's that show when you call an expert? I'm going to phone a friend.
Who wants to be a millionaire, I think.
Who wants to be a millionaire? So I'm going to call on our colleague Kayla here just to keep me honest. If someone qualifies for advanced premium tax credits, they can or can they not apply those tax credits toward dental coverage? I can't off the top of my mind remember the exact there are some limitations to that. So if she's not available to answer.
Yeah, I'm here, Nikki. Sorry about that.
No, that's okay. I was phoning my friend.
Yeah, no, you're right. This is a really tricky one, and I don't want to get into too much detail. But if you have a plan, the way the APT, the subsidies work, the extra ones will go towards the essential health benefit portion of that plan. And dental is a tricky one, and it's really going to depend on the type of dental plan. And I think what we can do on this one is maybe follow up when we share the presentation with a little more details on how that would work. But I also just wanted to share on COBRA and dental. We do know that the COBRA ARP subsidy that was covered in this presentation does go to dental. So you can absolutely use that COBRA ARP subsidy for dental plans if that's something that you have through an employer. But I think it would be best, Nikki, if you agree to maybe follow up with some details on the dental piece.
Absolutely, happy to do that. So for the person who asked, please be on the lookout for an email from us. Usually I send it within 24 hours of today's presentation.
Well, we have actually hit our mark. We did this in an hour. Nikki, thank you. Melissa, thank you. Kayla, thank you so much for pulling in there and getting together the questions. Nikki or Melissa, is there anything else you'd like to say before we end this webinar today?
Well, a thank you to everyone who participated, all of those who helped support this, and open enrollment is ending. Extended open enrollment is ending July 23rd. So please, if you need coverage or you know someone who does, please take action now and apply through mahealthconnector.org.
Yes, and I also agree with Nikki. Please take action. Open enrollment is ending July 23rd. So definitely take action. And thank you so much for everyone for participating today.
Perfect. Well, as everyone has stated here, this webinar will be passed around, and any follow-up to some of the questions will be also passed around along with a survey. Please fill out the survey if you get a chance. And thank you all for joining our webinar today. From everyone at the Health Connector, be safe and well.